as recording. Great. Right, so we are going to talk about inclusion and diversity. So I'm guessing everyone can hear me fine because we're all interacting in the chat, which is great. As we just said, we're going to record the session. Charlotte, if you wouldn't mind just clicking onto the next slide to show the agenda. So we're going to talk about Diversity Week, gender inclusivity and diversifying Marrow. So we are running this workshop because we want Marrow to be as inclusive and diverse as possible. We want to improve education surrounding diversity and inclusion within Marrow Life, because we think that quite often when it comes to approaching diversity and inclusion, there is a lack of education on why it's so important and how it can be integrated. This is why we're giving this presentation, to try and help kickstart the journey towards a more inclusive and diverse Marrow. We don't want to make anyone feel uncomfortable or shamed if we're not aware of these topics. This is a chance for us to learn together and make a positive change within Marrow. And as we'll just touch on at the end, there'll be more resources about inclusivity and diversity within Marrow coming from the Marrow Diversity Champions soon. So we can make sure that we're all as educated as possible moving forward. So first off, I'm going to hand over to Krishna to talk a little bit about Diversity Week.
Yeah, so Diversity Week is basically a compressed version of what used to be known as Tackling Inequalities Week, and it's basically a way to, if we can move on to the next slide, please. It's basically a campaign that we've revamped to encompass a wider range of inequalities. So we saw the success that Hero Week had, and we decided that we want to dedicate a single week to diversifying the register and trying to improve the statistics so that hopefully it can continue on for longer. So diversifying the register isn't something that can happen within a week, but it is a good place to start. And as most of you already know, as the register stands, a patient from a Caucasian background has a 72% chance of finding a match. However, if the patient is from a minority ethnic background, that number drops to a shockingly low 37%. And we want to change that because blood cancer does not discriminate. And the stem cell register shouldn't either. Can we go on to the next slide, please? So just a couple of ideas of what you can do. So a good place to start is to contact any cultural or religious societies that you may have at your university and see if you can go along to their events and do a short presentation. Make sure you contact the societies well in advance so you can create a schedule. If it is a religious event that you're attending, make sure you are respectful of the event and not using it as a way to guilt people into joining the register. And then I'm going to hand over to Ellie to talk about gender inclusivity.
Right, so first off, we're just going to start with some background on LGBTQIA+ rights in the UK at the moment, which should hopefully give a good overview as to why we as Marrow should be doing the most that we can to make sure that we are being gender inclusive. So currently, intersex people are not legally recognised in the UK. Despite not being either male or female, their sex is not recognised. Intersex people make up about 2% of the population, which is the same percentage of people with red hair, yet they're not legally recognised. Non-binary people are also not legally recognised by the UK government. Conversion therapy for queer and trans people is still legal in the UK. Despite improved acceptance of trans people in society, trans people still face high levels of harassment and discrimination. 51% of trans people have hidden their identity at work for fear of discrimination. Nearly 7 in 10 trans young people have been subjected to death threats in school. Additionally, under the current gender recognition legislation, which was passed in 2004, in order to change their birth certificate, an individual must be over the age of 18 and apply to a panel providing medical evidence of a diagnosis of gender dysphoria, as well as proof that they have been living in their gender for at least 2 years. Trans people have described the current medical requirements of the process as intrusive and humiliating. It places trans people in the uncomfortable position of having to prove their gender to an independent panel of strangers. Additionally, there is currently at least a 2-year waiting list to be seen in gender identity clinics. So this kind of gives like an overview as to the difficulties that trans and intersex and non-binary people face at the moment. And this is why as Marrow, we want to make sure that we're not adding any more difficulties to these individuals' lives when it comes to signing up to the stem cell register or getting involved with Marrow. So as it was touched on earlier in the donor recruitment talk, we are looking to change the sign-up process to make the sign-up process Well, I feel like there might be a different, have I skipped a slide here? I have skipped a slide here. Thank you. Sorry. So first off, why do we, as Amaro and Anthony Nolan, need to be more gender inclusive? So by ensuring that we know our potential donors' correct pronouns and gender, we ensure that we uphold the quality of the register and that we hold the correct information for our donors. Our donors are doing something incredible and life-changing for our patients, as all of you guys know. However, by not recognising and respecting who they are, their gender, their name, and their pronouns, we are actively causing them harm. When we don't refer to someone by their correct pronouns and names, it is a form of harassment. Additionally, due to covert and overt harassment trans and non-binary individuals face, they are at high risk of mental health difficulties and suicidal tendencies. By ensuring that we respect their pronouns and identity, we are playing a part in protecting the mental health of our donors, which is obviously super important. So one of the steps that Anthony Nolan and Mara are taking to make sure that we are protecting the mental health of our trans donors and non-binary donors is by changing the stem cell register application process. So as previously mentioned, around March this year, hopefully, we will be able to have two separate bits on the form, one where you put your sex identified at birth and the other where you put your gender identity. So you can put your sex assigned at birth as either male or female, and then your gender identity is either male, female, non-binary, or stating that you prefer to self-describe. And this is obviously a great step forward for making sure that the stem cell register is gender inclusive. In terms of top tips for recruitment events, just as you would never assume that someone's name or ethnicity based on how they look, if someone comes up to you at an event, never assume their gender identity. If you're referring to an individual that's signing up and you've not been told their gender identity or their pronouns, please refer to them in a gender neutral way. For example, if I was at a gender recruitment event with Krishna, I would say, hey, Krishna, would you mind talking to this individual about peripheral blood stem cell donation? Or if I was in an event with Robin, I'd say, Robin, I don't think they've done their swabs yet. Please, could you check? So just try and make sure that you're being gender neutral unless you've been told someone's gender identity or pronouns. Additionally, when you're talking about the sign-up form or the sign-up process, make sure that you utilize the correct terminology. So for example, making sure that you're using sex assigned at birth and gender identity. Additionally, if someone discloses to you their pronouns, always refer to them by their pronouns. Not doing so is an act of harassment. So please make sure that you're utilizing the correct pronouns for that person. So just as a little bit of a background, I wanted to talk a bit about understanding gender and gender identities and what trans means and what cisgender means. So sex assigned at birth is the sex that someone is assigned at birth based on their genitalia. So this is what we were asking people to put down on the form because it can be relevant for medical matching processes and to make sure that stem cell donations are going ahead in for the best possible conditions for both the patient and the donor. So this is why we ask for sex assigned at birth. But the reason why we're asking for gender identity is because the gender that someone identifies with is not necessarily the same as their sex assigned at birth. And this is when someone's sex assigned at birth is different to the gender identity that they identify with. This is known as someone being transgender. Please could you have the next slide? So just a bit of a gender 101 overview. Currently, gender is categorized into two distinct categories, so male and female. However, trans and transgender is a term that's applied to those whose gender identity is not the same as the sex they were assigned at birth. Cisgender is someone whose gender identity is the same as they were assigned at birth. Genderqueer and non-binary is a term applied to individuals who do not identify with the gender binary. And transitioning is the process where someone is changing their gender expression to match their gender identity. I don't know how many people did chemistry for A-level or even GCSE, but whenever I potentially get them mixed up, I tend to think of molecules like these two on the right here. And if someone's sex assigned at birth and gender match, they're on the same side of the molecule, and that is cisgender. And if their sex assigned at birth and their gender identity do not match, they're on the opposite side of the molecule and they're transgender, because I think from my chemistry knowledge, that's how you define different types of molecules, whether two carbon groups, for example, are on the same side, that would be known as cis, and if they're on the opposite side, that would be known as trans. So that's just a good way to keep it in my head. might be useful. I'm not sure if it's useful, but thought I'd chuck it in there anyway. So next slide, just kind of like another image to help you guys remember differences between cis and trans gender individuals and non-binary individuals. So transgender is an umbrella term for those who do not identify with the gender assigned to them at birth, as we've already discussed. And some non-binary folk identify as both non-binary and trans. Some people don't. So only refer to folk by terms that they use for themselves. While some transgender people are non-binary, many transgender people have a gender identity that is either male or female. So this is when they would describe as trans men or trans women. So you have the overall umbrella of transgender, and then if someone does define within the gender binary, then they would identify as either a trans man or a trans woman. If they don't, then they would identify as non-binary. So these are people whose sex assigned at birth and gender identity are different. If someone's sex assigned at birth and gender identity is the same, then they would identify as cisgender, so either a cis man or a cis woman. Great. So hopefully that makes sense. So now on to some top tips for being a trans ally in everyday life. When someone comes out to you, treat it as a compliment. They trust you enough to come out to you. Show empathy and understand the courage that it took them to come out with their gender identity to you. Never out a trans person. So if someone does come out to you, don't tell their story to anyone else. It's not your story to tell, it's theirs to tell. As previously mentioned, make sure you're using pronouns. Pronouns validate someone. So when someone is misgendered, this hurts and is a form of harassment. If you get it wrong, just apologize and move on and learn from that mistake. Words to avoid when talking about sex assigned at birth or gender identity or transgender individuals. Avoid real, biological, genetic and normal, like scrap those words from your vocabulary and stick to sex assigned at birth and gender identity. So words to use to refer to someone whose gender identity matches with the sex assigned at birth is cisgender. So I'm a cisgender woman. Words to avoid saying about trans people: transgender, transgendering, transgenders. Scrap all of those from the vocabulary and refer to people as trans people or transgender people or trans men or trans women. Don't say born a boy or born a girl, but assigned female at birth or assigned male at birth. Never dead name someone. So a dead name is someone's birth name. Even if you know someone's dead name, this should never be said to refer to the person. Also, never ask about genitalia or surgeries. Trans people are trans, whether they have had surgeries or not. You wouldn't go around asking your cisgender pals about their genitals, so don't go around asking transgender individuals about their genitals either. Additionally, don't judge people on how they look or sound, and never force anyone to use a gender toilet they are not comfortable with. So just the final slide about gender inclusivity is making sure that we're utilising the correct terminology. So these are the words to make sure that you get into your head and use these as much as possible. Anything else that's not on this list, then try and forget about. Obviously, terms do get updated, so do regularly do some research into the most appropriate way to speak about and with transgender individuals to make sure you're being as gender inclusive as possible. So we want to use the words personal pronouns, transgender person, transgender man, transgender woman, assigned sex at birth, assigned female at birth if they were assigned the sex of female at birth, assigned male at birth if they're assigned the sex of male at birth, assigned X at birth is assigned intersex at birth. Other terms such as gender dysphoria, gender confirming surgery, and gender affirming surgery. So that's all for me on gender inclusivity. I will now pass back over to Krishna to talk a bit about diversifying marrow.
Okay, so diversifying marrow doesn't just mean that we need to diversify the register, it is so much more. When you're marrowing, you are a representative of Anthony Nolan, so you need to make sure that you remain respectful regardless of race or culture. For example, if you're holding joint events with societies, make sure you do your research around cultural events prior to arranging collaborations. And there will be resources regarding this in the upcoming inclusivity guide. Sometimes it may feel uncomfortable to celebrate religious events because you might be worried about how these celebrations may be perceived. Make sure that whatever you're discussing is relevant to the event, festival, organization, and check in with the people you know who follow this faith. Do your research. Separate religious celebration posts on social media from asking for sign-ups, making sure the celebration is genuine rather than pandering. And this will help you build relationships with societies who may be more receptive if you've shown that you're aware of different cultural events. Essentially, do your research and make sure everything you post is relevant to the event. Maro understands and recognizes that racism has played a significant role in the development of medical sciences. When approaching an individual of a different race, make sure you do this with care and sympathy. It is important to remember that some groups may have a more complex relationship with healthcare situations that you may not be aware of. You may want to carry out further research, including, for example, the cases of Henrietta Lacks, the Tuskegee syphilis study, and the Dr. Mengele experiences, although these may be upsetting to read. Lastly, donor recruitment should not feel like pressure. Potential donors need to know that they can say no and there is no obligation to sign up. The donor recruitment space should be safe where potential recruits can say no. Presenting statistics is important, but the conversation needs to remain open. Maybe finishing the conversation with, does this sound okay to you, before signing them up.
Sorry, Krishna. So just a little note on what's coming soon from the Maro Diversity Champions. So we are currently in the process of creating an entire inclusivity resource, which will contain information about ability and disability, ethnicity, gender, sexuality, and faith. We will also be providing more information about what your Maro group can do to make your group more inclusive and diverse. We are also creating a cultural and awareness day planner, and hopefully we will be giving some talks and workshops about how to make sure we're being inclusive and diverse. So just a last note to summarize up before we take any questions or any suggestions for making sure that Maro is more inclusive and diverse. We don't want to jump on any bandwagon. This isn't about virtue signaling. We want to make sure that Maro is an inclusive and diverse place. We want to make sure that Maro is aligned and acts with these values. We are making a real effort to change our approach to diversity and inclusivity. It's not for show, as I just mentioned. We want a welcoming community that is reflective of our wider society. We want to integrate inclusivity and diversity into all our resources, and more information on how to do this is coming soon. So please make sure that when you're becoming more inclusive and diverse, it's not just an act, you're actually being aligned with those values of making sure that Maro is a more inclusive and diverse place. We're really lucky in the fact that we've been able to work with ACLT, Afro-Caribbean Leukemia Trust, in the past, and they're one of our charity partners. Please go and check them out and look for more resources from them about how to recruit individuals from minority ethnic backgrounds. We've had amazing talks from them in the past, and they will also be our guest speakers at this conference. And they're really helping us to make sure that we're making sure that Maro is inclusive and diverse. So we just wanted to give them a special mention, as they've done an incredible job helping to diversify the register. And we're so excited to hear them talk about their work later. That's all from us. Are there any questions or suggestions about how to make Maro more inclusive and diverse?